Guys, this is Dr. Mobeen Sayed from Drbeen.com. The topic that we are going to discuss today is about the long haulers, as we are calling them, or as these patients are calling themselves. These are the patients who had mild symptoms or COVID-19 and then did not recover fully, or even if they recovered, afterwards they developed some more symptoms and then continued on to having symptoms for more weeks. And I have had discussions with some of the patients who have these symptoms for months now. So the question in all of our mind is, what is happening with the long haulers? What may be the reasons for that, and how to try to manage that, and what is the situation there? So that is the basic topic today. We are going to start discussing that, and then most of the answers here, it is still not clear why does this happen. However, there are some speculations, there are some possibilities, and I'm going to go into those details and then filter out which possibilities may be more possible compared to the other possibilities which will be less possible. So with this, let's start our discussion. I have a few things as well to discuss with you before we go into this long haulers discussion. So I'm going to share my screen. So here are some of the things that I have some questions for you. So first of all, I was thinking that we should create a separate channels that is dedicated only for the vitamins, for the supplements, for the food, organic food, and how do they help us, and what is the dose, and what should we do, and what are their mechanism of actions. So this channel, Drbeen.com channel, is mostly a medical channel. And what do you think? Should we create another channel separately dedicated to that? So that is one question that I have for you. Secondly, I wanted to show you, I saw some data coming out of India about hydroxychloroquine, and I wanted to show you that data. It is preliminary data. It was tweeted by someone, and I thought this was exciting. So let's look at that data very quickly before we continue with our discussion. So here, Freebird is someone who tweeted this data to me. And then this is by someone, her name is Subhashri Ray. And here is the interesting thing here. This is about hydroxychloroquine. Until Wednesday, the Vadodara Municipal Corporation has administered the drug to 3.42 lakh persons. That is 3.42, 1 lakh is 100,000. So 3,400,000 people, including health workers and other frontline staff. Each of these persons has or will have completed the entire course of the drug, 400 milligram twice a day for the first dose and 400 milligram per week for minimum of the 3 weeks. And we had done this discussion in the past that the prophylactic regime that India had offered to their essential workers was the very first day, in 1 week, 1 day, 800 milligram loading dose, and then every week, 1 day only, 400 milligram continuing dose. I think they had prescribed it for 6 weeks for essential workers and for 3 weeks for people who were taking care of the COVID-19 patients at home. So look at their results. Of this, the administration has analyzed a sample of over 1 lakh, so 100,000 residents who were mostly close contacts of positive persons and the effect of ACQ in containing the transmission of the virus. According to the analysis of the 48,873 close contacts of positive patients who took 1 dose of hydroxychloroquine, 102, so this is about 100,000 people, out of 100,000 people, 102 turned COVID-19 positive and 12 succumbed to the infection. Whereas, so out of 100,000 people, 12 deaths because they were taking hydroxychloroquine. So this is a very tiny number of deaths. Once again, even 1 death is a lot, but if you look at the COVID-19's death rate compared to that, the people on the prophylaxis with hydroxychloroquine did really well. Now, whereas 48 of the 17,776 close contacts of positive patients who took 2 doses of ACQ turned positive and only 1 died. So again, I would not put the word only there. Even one death is a lot of death, or is a tragedy for that family. The study also states that of the 33,563 close contacts of the patients who took 3 ACQ doses, 43 tested positive and one died. So this, I thought that it was very interesting, and I wanted to share this with you. The second thing here, a company is putting together, so this is an interesting one. Someone reached out to me and they said that they are going over our content on YouTube, and they are writing in written form, they're writing material based on our videos and in multiple languages, and creating, I think, either books or they're creating the website content. So I think that was very exciting. So thank you very much for all the cool beans who have stuck with me. We have actually reached above 100 videos now. I think it is 103 or 106 videos. And we have been discussing COVID-19 related topics every 6 days in a week. So I'm very happy that we have a significant amount of content now, that people are using this to kind of write content. Then another thing that is important is that as this social media keeps pulling the videos down and other banning them and shadow banning them, I had promised to you that I would make these available on our site and for free. So here is the way to get to them. So if you go to drbeen.com, so this is the site that I run. So on the drbeen.com, on the main page, there is try for free now. And there is no trick there. We do not ask for any payment information. All we need is your email address and your password so we can create an account for you. We could not figure out a way yet. Technically, this was the fastest route we could do, that once you have the free trial, you do not have to pay afterwards as well when the free trial finishes. The videos for the COVID-19 would stay available even when the free trial expires. No payment is needed, no credit card information is needed. There is no trick here. This was the quickest way that we could do technically to bring you that data, that COVID-19 content on our site, so that nobody can pull it down and we can continue to serve you. So this is another thing I wanted to make sure that you can do it. Just go here, click on the try for free now. You would reach this second page where you can just place your name and email address, and we would generate a password and send it to you on that email address. And that is how you would get the access. Free trial normally expires in 14 days. This would happen here as well. You would not have access to other content, but COVID-19 content would continue to be freely available to you. And then finally, there is an exciting news. Remember, I've been talking about leronlimab, and I've been saying that I would love to talk with their CEO to understand what is their strategy and how is their market traction and so on. So someone who was on yesterday with us, Mike Sheikh, he has promised to have us contact with the CEO of the Cytodine. So hopefully I would talk with them, and if possible, have them on our show maybe this Saturday or in the coming week. So these are some of the news here. Now let's go to one more thing, and that is some of the supplements that have been sent. So this is Janet. She has sent these supplements. So zinc, ivermectin, 8 milligram, Pepsid. So of course, ivermectin is not a supplement. Pepsid, vitamin C, artemisinin, quercetin, aspirin, not a supplement drug. Vitamin C here, vitamin D, NAC, manganese, I believe, and melatonin and selenium. So that is Janet. Then we have, sorry about that, we have DAZA, and this is the supplements from DAZA. So they have NAC, vitamin D3, Centrum, vitamin C and zinc, and CoQ10. And then Bernardo, here is their supplements. This is a full shelf of the supplements here. And so in this we have Kiefer's culture, Then stress savior, I do not know what is exactly in here. Melatonin, uh, sun warrior protein, omega fish oil, quercetin, NAPA, NAC, zinc. Um, I think this is C as well. Vitamin D3 and K2, apple cider, fire cider. This is probably dark chocolate. I have my chocolate here as well. So chocolate is here, and green superfood. And finally, here is focus AI, low calorie something. So these are the supplements that they are taking with this. Now let's continue to our primary discussion for the day, and that is about the long haulers. So here, long haulers, or as some of the folks call them, long tailers, this is the primary set of the symptoms. Most of the time, and I'm going to show you some of the references here, most of the time what happens is that folks who have mild symptoms in the beginning, some of them seem to have continuity of those symptoms even after when they have fully or sort of recovered. And I've seen that in my patients as well, that they recover. So for example, one of the cases, and I would discuss those cases, one of the cases had cough and fever and shortness of breath. And that stayed on with her for about a couple of weeks. Then that symptom went away. And soon after that, a few days later, she developed cough and fatigue. And then that continued for some time. And then cough became so bad that she developed dysphagia because of the continuity in coughing. And that is still continuing. There is one more case in my patients where the patient started with fever and I believe mild cough and fatigue, and then they recovered. And after that, she still had the RT-PCR positive, and after that, she started developing body aches and fatigue. So one more person in a similar vein, she had headaches in the beginning, and those headaches continued then, plus she had tachycardia, then she recovered from that, and then headache continued. And so I had to do some of the management that finally we could get rid of those symptoms. But this is something that is experienced by many people, not only for a few more weeks than normal, but even months. So what I have made here is that this is the primary monster of the COVID-19 symptoms. And then there is a continuity of a long tail of the symptoms. An interesting thing is that the symptoms that they get may not be the same symptoms with which the COVID-19 had started. So the intensity of the symptom changes, the frequency of the symptom changes, and the symptom itself can change as well. So I had made this one, and just for fun, my wife, she's an animator. So she came over and she said, well, this monster thing doesn't read very well. You should make a Loch Ness monster. And that is where these are the the long tail. So I made in her honor the Loch Ness monster over here as well. Continuing on to the question of what are the possible reasons? Why can this happen? So there are some reasons that are plausible. There are some that are not plausible, but these are the discussions that I'm seeing in various articles. I'm seeing by various doctors, by my colleagues. I'm seeing those discussions or thoughts coming to my mind as well. So let's look at those. So possible reasons. One very common reason has been reinfection. And this has been going on since March, when Japan and South Korea had articles coming out that said that there may be reinfection and there are people who are becoming positive again. And then they came back and there was a possibility that this was maybe when they were discharged from the hospital. At that time, the test that was negative may have been a false negative. Or maybe the next test was more sensitive or erroneous. So there could be a testing and sampling and handling issue. WHO got involved at that time. I still remember it. They had put a statement out saying, we are looking into this and we would come back with more data. As far as I know, they have not come back with any data. I think that was a way to kind of just sweep it under the rug. And then that thing went away. A few days ago, I saw another article where, and I shared it with you as well, where we saw that in Pakistan there was a case reported, just an anecdotal thing, that there is a possibility of reinfection. So again, is reinfection really possible? I had that discussion done in the past, that at least in theory, so far, we have not seen the possibility of reinfection because the antibodies build up in normal healthy individuals. But anyways, one of the possibility is that maybe there is reinfection. Another possibility is that there may be reactivation. And the reactivation, so there is a comment by Denise, I am a long hauler and now getting a big time flare for the third time since January. And Denise, would you like to tell us a little more that what are the symptoms, and are these the same symptoms as you had started with, or these are different symptoms? So another possibility is reactivation. And in the case of reactivation, like herpes has a reactivation phenomena where we think that the virus hides somewhere in the body and then it becomes reactivated. So far with the coronaviruses, we have not seen reactivation. So this may be, the reactivation may be that the test that was done, that was used to discharge a person, maybe that test was a false negative. And then the person got discharged and they got retested and they had positive, but maybe the previous test was incorrect. Reactivation so far has not been observed with the coronaviruses. Again, this is an area where there is still research going on, there is still data being collected, but this is true that there are folks who are long haulers. This is true that there is an issue going on. So reactivation is another, and Denise has responded and said, I have 0 antibodies being tested 2 times now. No, I'm gluten-free and 0 added sugar or salts. So Denise, what are your symptoms? So back here to the discussion, then here is one more reason for the possibility of the long haul. And I'm so sorry for Luffy's chiming in as well. One is that, look, there can be possibility of the tissue damage. For example, let's say that the blood vessels got damaged, or the cardiac tissue got damaged, or renal tissue got damaged, or the lungs got damaged, which is a primary target, and then they take a little more time to become healed. So the tissue damage may be one of the reasons for lingering symptoms to continue. And that I classified in 2 ways. One is the repairable damage. That is a damage where the lungs, for example, got damaged, and that damage is slowly now repairing, and during that time there are symptoms. Or irreparable damage, and this is mostly for the folks who went through the severe cases where they had lots of lung damage and fibrosis and organization of the pneumonia, and now they are continuing to have a lung or lungs that are not fully functional because of the lack of the tissue which has become damaged, or the lack of the tissue which is healthy, and now they are dependent on oxygen, or they are having long-term issues, and they would probably need to learn how to rehabilitate and how to work with how to kind of start making their lungs functional. And some people may not be able to make them fully functional again. So this is another possibility. Then virus remnants, which may trigger immune system. And I'm not drawing all those mechanisms because I feel that we have done those discussions in the past, that how does the immune system work. If you would like, we can do a follow-up and discuss immune mechanisms. But now imagine that in a cell, the virus remnants are still present. Virus broken pieces are still present. And they are still causing the immune system to continue to respond and to continue to kind of react to those pieces of virus. And these virus species are still maybe presented on the antigen presenting cells, and that is what is causing the immune system to continue to respond. So that is possible. Then incorrect test results. As I just discussed, it is possible that the test results were not correct in the first place, and the patient got discharged with them, and now the disease is still present, or the virus is still present and replicating. Then it is possible that immune system itself got into a sustained state. And we have done this discussion as well in the past, that what happens is that the immune system, there is the innate arm and there is the adaptive arm. So let me just try to draw that here. We've done this, that here is, let's say, a dendritic cell or a macrophage, and that eats up a coronavirus, and then it presents it to the naive T cells. And we know that then they go T helper 2 path or T helper 1 path, and then T helper 2 or 1, 2 goes towards B cells and 1 goes towards cytotoxic T cell. And this set of cells in turn release a lot of interleukins, right? So interleukin 1 from macrophage, interleukin 6, interleukin 8, tumor necrosis factor, granulocyte, monocyte, colony stimulating factor, interleukin 12, and so on. And then we know that from this area, we can have interferon gamma that is released. We can also have interleukin 2 developed here, interleukin 4, interleukin 5, interleukin 10, and so on. And we know that these components of the adaptive arm and the innate arm kind of amplify each other's behavior or each other's function. And it is possible that this function becomes more amplified enough that it sustains itself. And that sustenance of the immune system's abnormality in this case is, maybe it is possible because of there are genetic issues where immune system doesn't function correctly, or there are supplement or the vitamins dysregulations, or maybe there are food issues, maybe there are other comorbidities that cause the immune system to stay imbalanced, or maybe there is something else that we yet do not know. So that is the immune system dysregulation that causes the immune system to sustain itself. And we have seen these kind of things in other diseases. For example, most of the chronic autoimmune diseases have some sort of a mechanism in which immune system finds a way to stay sustained. And then unknown, maybe there are more mechanisms that we are not aware of. And we'll figure those out later. There was a study done by the King's College, London, and they had said that 10% of the people reported symptoms for 3 weeks. These folks are mostly young, and when they had the original disease, they had mild symptoms. And so I would like us to look at one more document, which I thought is very well done. So here, if I can bring you to this document, and I have put the link to this document in the description as well. So this document is produced by the organization is called Body Politics Slack Group. So they have a Slack group, and what they've done is they have collected data from 640 COVID patients who had recovered and then went into a long haul, and they asked them that what was their original symptoms, what are they feeling now, how long did they have the symptoms, if they have any comorbidities, etc. So it is interesting to see the data here, or the summary of their the issues that the patients are seeing. So let me just very quickly show you that. And there is a ton of data here. I would encourage you to go to this Google document and walk through this, and it's very interesting. So see here, highlights of the survey analysis. Almost half of the respondents were not tested. Then respondents who reported testing positive were tested earlier in their illness on average by 10 days. The difference between the two populations is statistically significant. This could reinforce the importance of testing symptomatic people early. Over half of the respondents listed at least one pre-existing condition. The vast majority of the participants with symptoms experienced fluctuations. So see fluctuations in the symptoms, both in type and intensity. So this is very important, and I have seen that with my patients as well, that sometimes they start with, let's say, shortness of breath, and then the later on symptoms, the lingering symptoms are, for example, fatigue. So the symptom that they started with the original disease are different from the symptom that they are experiencing later on, or maybe the intensity is different, or maybe the frequency. One thing that is really important to keep in mind with the COVID-19, and I see that with our patients very often, is that the symptoms are not necessarily always continuous. It is not necessary that the fever continues on or the cough continues on throughout the day and night. these symptoms are intermittent. Fever sometimes come in and then goes away, or cough appears and then goes away, or shortness of breath appears for 5 minutes, mostly in the early morning, and then it goes away. So the symptoms fluctuate in intensity and in type. So that is a very important takeaway here. At the time they took the survey, 90% of the respondents had not recovered yet. So what they saw was that 27 days was a common average that they saw. However, there are 5 to 7 weeks. And in my own cases, when I am looking at some of the patients, I'm seeing some of them continuing beyond a month. I am fortunate that I have been using some of the medicines to be able to get rid of those last lingering symptoms as well. So I would discuss that. But again, please note that this is not a prescription for anyone. Do not self-medicate yourself. I am not prescribing it to anyone. I'm talking about the patients that I had and how did I get rid of their lingering symptoms. On symptoms, is slightly so what are the symptoms that they're seeing? Slightly elevated body temperature, fatigue. So fatigue is a very common lingering symptom that I see. Brain fog, concentration issues, chills, sweats, trouble sleeping, loss of appetite. Patients from this survey indicate that their first week of experiencing symptoms had milder, fewer symptoms. So we talked about that. So I would like, if this is one more thing that is important, and that is that they say that we have been ignoring, we as a community, as human beings, medical staff and patients, we have been ignoring the mental or the brain related issues. So those issues are dizziness, tachycardia is there, brain fog is there, concentration is there, concentration challenges and dizziness. In addition to that, so of course, tachycardia is not a brain activity issue, but they have tachycardia, they have lung burn, they have GIT symptoms. I am actually seeing some patients where GIT symptoms occurred about 3 weeks ago, and they persisted intermittently over 3-4 days. That the person felt cramps and diarrhea one day, became okay the next day, 2 days later had the diarrhea again, and so on, and then recovered, and then 2 weeks later, they have diarrhea again. Neurological symptoms, dizziness, seizures, concentration challenges, brain fog, etc. So I would request you to kind of look at this document. It is very interesting. I'm going to go back here to our discussion. So I wanted to show a couple of cases as well, a few cases too. So this is a case that is actually published. That is why I'm using their name. The case is published here. Here in this today, there is the case that was published, and here is the doctor's name. That is why I used his name, and his history is out there. So here is what they saw in this case. So doctor is Dr. Scott Krakower, if I did not cause too much issue with the last name. So he had COVID-19 positive in April. However, in July, so look at this, in April, the person was positive. Now it is July, and the person is that doctor is still not able to return to work. He's a psychiatrist because of the daily ups and downs in the symptoms. And he said that the mornings are better, shortness of breath and voice related issues, they appear near 1 or 2 o'clock. His doctor finally offered dexamethasone. And this is a similar thing. I do not use dexamethasone, but I use delta-cotril. So he started using dexamethasone when this issue continued, and then within 24 to 48 hours, the patient started feeling better, and he is saying that he was coughing so much that he had issue with swallowing, and he said that that is now becoming better as well. So just over here, a side note, that is what I've seen, that when I see a patient going into the lingering state, I usually use delta-cotril. And again, please do not prescribe yourself or self-medicate yourself. The steroids, when stopped abruptly, can cause issues. Plus, steroids can cause other issues as well. So you have to be sure that you can take steroids or not. So please talk with your doctor about it. I have used delta-cotril for my patients, and I taper it off. So the 5 milligram thrice a day, then for 2 days, then 5 milligram twice a day for 2 days, then 5 milligram once a day for 2 days and then stop. And I have seen very good results for these lingering, long hauling symptoms. I'm saying it again and again, this is not a prescription for anyone. Here is one more case. In this case, so this patient, she was my patient, has about, so I think there are 4 family members: mother, father, sister, and a brother. All of them became COVID positive. Mother had the symptom of headache only. With that, she developed tachycardia. The patient herself, who contacted me, she's a medical student, she started having originally fever and some shortness of breath and cough, I believe. Afterwards, the family recovered. Father had the more typical symptoms of shortness of breath and cough and fever. However, everyone recovered in about a couple of weeks. After that, mother and daughter, her name is Shamama, they continue to have the symptoms for another, it just continued for another few days. So she became worried that so she started having fatigue. And she said that I'm so fatigued and I have so much myalgias, muscle pains, that I cannot even walk and I cannot sit upright for some time. I become very tired and I become exhausted and my muscles ache that I have to lie down. So about 2 or 3 days of observing, I started them on the steroids, and both of them recovered within 2 to 3 days after that. So that was an interesting case as well. Others in the home did not have this. So it is not necessary that everyone develops it. It is some people who develop it. Then here is another case of a family that I managed. So again, father, mother, brothers, and sister. Originally, brothers seemed to have more of the issues compared to the rest of the family, but brothers recovered. They were younger, they recovered, and the sister continued to have, she transitioned from fever and cough to cough only and fatigue. And then cough became so big after recovering after 14 days. Then the cough reappeared, and then it slightly increased in intensity. And then it became so bad that she developed dysphagia because of all of the injury in that area. So she's still continuing. It is a month later. I had not started her on the steroids. I try to avoid steroids as much as possible. So I had not started her on steroids. I discussed with her this morning that we may have to do it. But she is now recovering. Then there is another case which is very interesting. I did not manage this case, but this is also another student of mine. He's a medical doctor who is doing residency, and he became COVID-19 positive. And his situation is that he became positive, he went into quarantine, and then about a month later, he still has the symptoms and RT-PCR is positive. Sorry, he didn't have the symptoms. His symptoms recovered, but he continued to have RT-PCR positive. And many, many tests were done, and they were all positive. So either he has become a carrier, or the tests, so many tests are wrong. Both could be possible, or maybe there is a third reason. But that is also something of a lingering virus still available in the nasal areas. And now the question is, can it be possible that the virus is still available or detected in these areas? So one of the possibilities is this. Look, let's say this is a macrophage. And the macrophage has been eating up the viruses. And remember that it eats them up, it breaks them up, then it presents them on its surface. Macrophages themselves have a short life as well. Normally, when a macrophage has done 100 phagocytosis or has eaten 100 times, then usually it becomes tired and dies as well. But it is possible that the macrophages at the cutoff point where the symptoms started going down, at that time, those macrophages had eaten up some viruses. Now, majority of the viral load in the body has reduced, symptoms have gone away, but this macrophage still has the virus in it and it is still presenting it, and it is going to stay there for some more time. And maybe virus is still replicating, if at all, and that is still spreading to the nearby other cells who are still presenting it or still have the virus, but at the same time, immune system has become strong enough that it has taken care of the virus in general. So now it is the viral RNA is still being detected inside the cells or outside the cell, and we feel that the RT-PCR is positive. I had done one more discussion, I think yesterday or day before yesterday, where we discussed those folks who do not have antibodies, still had the COVID-19, and their memory T cells are positive for COVID. So it is also possible that the patients do not have the right path. Remember, the path is that we go to naive T cell, from there we go to Th2, from there we go to the B cells, and B cells make antibodies. That is a normal path that we take, or our body immune system takes. Then it is possible that Th1 pathway becomes activated as well. That goes to cytotoxic system, cytotoxic, if I can write toxic cells. And this pathway, when it is engaged, it is possible that antibodies are not there. Now, this is also possible that the innate arm is working with the adaptive arm, but it's not working with the right power, the whole immune system, that it can take care of the virus. So the virus is still sitting there. So that is also possible. So the test results can be wrong, the samples can be wrong, immune system can be dysregulated. That immune system dysregulation may be genetic, that may be because of the vitamins, imbalances, antioxidant imbalances, that may be that the patient is living in an area where, for example, let's say vitamin D is not sufficient, and so on. So there can be many, many reasons, from human error to immune system error to incorrect immune pathway taken, to incorrect innate arm there, or to a possibility of patient becoming a carrier. Usually when a patient is a carrier, we feel that they would not have the symptoms, but they just have the virus. Here I'm seeing that there are some patients who have the symptoms, and then some patients who do not have the symptoms, but the virus is still present. Now, we talked about this at the usual symptoms. Intermittent fever. So intermittent is very important. The frequency and the appearance of the fever is not continuous. It is frequent. It comes in the morning or evening and then goes away. Intermittent fever, headache, neurological symptoms, for example, dizziness, brain fog, and so on, concentration challenges. Cough is very common. Fatigue is very common afterwards. Fatigue is the most common I'm seeing is fatigue, myalgias and tiredness, sleepiness. Shortness of breath, I have seen less that the shortness of breath continues, but shortness of breath can be there. Intermittent stomach upset and diarrhea. And so I have seen that this sometimes can continue on for weeks, and there are gaps where the patient doesn't have any issue, and then the diarrhea starts again. So this is the basic discussion for today. The management approach is, so we still do not know what is the right way to manage this. We still do not know what is the cause of this, what is the exact pathology of this. Most of the discussion points that I just presented to you are speculations, are thoughts that this may have happened. Due to that, the exact management is not out there. However, this is true. This is a common thing, that there is something going on with the immune system, that it is still causing systematic or systemic inflammation and causing those issues. So steroids is a good choice to kind of suppress that inflammation or calm it down, and then go from there. So this is the discussion for today. Thank you very much. I will continue our talk tomorrow, and hopefully we'll also have Cytodine folks with us. If there is anything you would like to discuss, please put that out there. And my request to you all, please like, subscribe, and share. Thank you very much.